Tonight, that health headline involving antibiotics and infants. Researchers are saying this practice is strongly linked to people getting sick later in life.
Kind of scary to hear that. Our chief health editor, Dr. Partha Nandi, here now. And Doctor, how are they figuring this out at this point? Because, you know, parents are going, oh, no.
Yeah, it's a lot to worry about because you try to help your kids. So what we're doing is looking at a study from the University of Minnesota, and the researchers found that antibiotics may change the bacteria in babies' guts. Now, what I'm talking about is bacteria linked from everything from allergies to obesity to infectious diseases. They examined hundreds of studies and determined that there's a strong tie between antibiotic use in babies and changes in gut bacteria and diseases in adulthood. In some cases, the antibiotics eliminated key gut bacteria in infants that are needed to help immune cells mature. And you need those cells to fight off allergens. In other cases, the practice was tied to higher levels of short-chain fatty acids, and that can lead to obesity. The study's senior author, Dan Knight, said he believes the findings can help develop a roadmap for future research.
Wow.
So that's pretty interesting.
So their little bodies can't really handle it that well. Do you think we use too many antibiotics because we go right for them? We want it gone, I mean, as parents.
Yes.
Yeah, we're all parents, and that's the thing. When your kid's sick, especially, we're talking about kids less than 1 year of age, you want them to get treated appropriately. But the problem is this, that they've now seen that 30% of antibiotics are being prescribed unnecessarily. So I think a lot of people are going to their doctor and expecting something to be done. You don't go to your doctor, and then if you don't get an antibiotic, you feel like you're not served. So we got to be a little bit more careful, I think.
So, doctor, explain how this bacteria in our guts affect our immune system, even our weight, right?
Yeah, this is where my science geek comes out, because I get excited. Here's the reason why, because now we're finding out that the bacteria in your gut kind of helps your immune system develop as infants. So when it does that, it's almost like your kids, right? You want your kids to go out and experience life. If you keep them in the closet all day, they will never realize what's normal and not abnormal. The same thing happens with gut bacteria. If you don't have the right gut bacteria, the immune system doesn't develop properly, so it can't tell what's almost abnormal and normal, and then you can tend to have hyper-abnormal responses, so you can have allergic responses, and it can also help immunity and regulate that. Now, as far as obesity, this is exciting. We now know that the bacteria in an infant or a child or an adult can actually result in them possibly being obese or not. So if we know that, then we can treat them. We know that if they get the right gut bacteria, perhaps we can stop this epidemic of obesity. So to me, it's really exciting. So the bottom line is that, you know what can we do about this? I think as parents, we've got to be more judicious, a little wiser. Listen, if your kid needs antibiotics and they're sick, yeah, do it. But if you can avoid it, let's not force our doctors to pull the trigger on antibiotics and have them, be kind of like, okay, you got to give me something or else I got to go somewhere else. And that's happening to us all the time.
Sometimes home remedies are best.
Yeah,
absolutely.
There's children's Motrin. There's all kinds of things that you can try to supplement and help their symptoms.
Get educated. Talk to your doctor and work with them as a partner.
Sounds good.
All right. Thanks a lot, Dr. Nandi.
Thank you.
And if you have any questions that you would like to ask Dr. Nandi, you can always contact him. Email him at drnandi@WXYZ.com. Or you can send it to us on Facebook, Twitter. We'll get you right in touch with the good doctor.